Okay, hello everyone, and welcome to Ask a Doctor. Today we have two powerful women in our midst who will be taking us in today's session. So, with me here, I have Dr. Nneka Unya. She is a hematologist at the at UNTH. UNTH is the University of Nigeria Teaching Hospital, and we also have Dr. Chioma Ejim. She is a public health physician also at UNTH. So, welcome, powerful women.
Thank you.
Thank you.
Okay, you're welcome. So quickly, let's get running. We are going to be talking about sickle cell anemia. You know, I've heard about this sickle cell anemia, and I keep wondering what it is. And I'm wondering, I know people also wonder what sickle cell anemia is. So today, we would like you ladies to break this down to us. You know, we are laymen, so don't use those big grammar for us. Okay, so Dr. Nneka, can you tell us what sickle cell anemia is?
Okay, thank you for that. Sickle cell anemia is a health condition in which an individual inherits an abnormal form of hemoglobin called hemoglobin S from the parents, each from the parents actually, and it ends up causing the individual to, the red blood cell of the individual becomes sickle-shaped when there is a reduced oxygen flow into the system.
Is that why it's called hemoglobin S? Do you mean S or X?
I actually mean hemoglobin S.
Okay.
S as in sit.
S as in stick. Yeah.
Okay. Okay. So that's quite interesting. You know. So let's look at the causes of sickle cell anemia. Dr. Chioma, you know, tell laymen like us what causes sickle cell anemia, so we'll get to know.
All right. Thank you very much for the question. So the causes of sickle cell anemia, like Dr. Ifunanya already mentioned, she talked about hemoglobin S. So we have the blood cells. We have basically three of them. There is the red blood cell, there is the white blood cell. We also have platelets. So, but let's talk about the red blood cells now. So this hemoglobin that she talked about is a protein, is a component of the red blood cell. It's something that you find in the red blood cell that helps to, carry oxygen, because the red blood cell is supposed to trap oxygen. When someone breathes, they take in oxygen, right? So the hemoglobin is supposed to help trap it, and then the hemoglobin is inside the red blood cell, so it now gets it to circulate around the body. Yes, where you have oxygenated blood going around the body, and when it's all being used, the body has collected the different parts of the oxygen that it needs. You now take back the oxygenated blood, the one now that is without oxygen, it takes it out. Okay, so that's the hemoglobin that she was talking about. And everything about sickle cell anemia centers on the red blood cell, on the red blood cell component of the blood cell. So what causes it is when an individual has the genotype SS. So there's something called genotype. Every individual has a significant genotype. So we have basically three. Okay, there are five, but the main ones are three. So there is the AA, there is the AS, there is the SS, there is still AC and SC. So, but the mostly talked about is the first three. So there is AA, AS, and SS. So what causes sickle cell anemia is when an individual, like she said, has inherited SS from both parents. So the components the person gets from the mother and the father are the S and the S part of, the genotype.
Yeah.
So this makes the person to now come down with sickle cell anemia, because that red blood cell in the sickle cell in the SS genotype is sickle shaped. That's even where the name comes from. Sickle is I think is a farming instrument
Yeah.
that is called
Something
sickle. It has a
something like
C. Thank you, sir. It has a C shape kind of. Yes. Like a moon, crescent, half moon. That's
yeah.
what it looks like. So the normal red blood cell in an individual is supposed to be spherical shape or round shaped.
Oh.
And the essence is for it to be flexible so that it can, move around normally as it's carrying that oxygen, as it's
Yeah.
moving from one place to the other. But that sickle shape is now thick and is sticky, so it doesn't move about normally. So there is always that abnormal flow of oxygen because it's not flowing well. That sickle shape limits it. Instead of the normal spherical or round shape, is sickle shaped. Okay, so this is basically what causes sickle cell. So the person has to inherit the SS from both parents. Thank
Wow.
you.
Quite interesting. Okay. So let's look at the symptoms. I mean, how if a child is born, how would you get to know that that child, has sickle cell anemia? I mean, what are the symptoms that maybe parents should look out for to know that a child has sickle cell anemia? Yep.
Okay, I would take that. There's basically a whole lot this patient come down with. A whole lot. Um, Starting from infancy, as early as about 6 months, this patient can the diagnosis of that can be made based on the symptoms, on what they start presenting with. So most times these people start presenting with yellowish discoloration of the eye. That's usually the one that is very glaring. So, and of course they don't usually grow like other children grow. They are usually small for age. That's what we usually call. They don't usually grow like others. And um another common one they usually present with is something called dactylitis, a case whereby there is swelling and painful feet and hands. So the pains can be so severe. The other ones, like this is very common, called bone pain crisis. The bones, especially the legs and hands, will be in pain. Then all the way from the nervous system down to the feet, they have a whole lot of symptoms they can present with, including as serious as stroke. They can actually have stroke. And
Stroke.
really, yes, it can
So
be.
we're talking about, like, can young people have stroke?
Yes,
Yes,
I
sir.
have lots of them. We actually have lots of them in the hospital presently,
Wow.
and it can be. It's not funny. It's not funny. Of course, all these things is due to the reduced oxygen supply to these tissues, to the brain.
Yeah.
When
To
there is
function.
reduced oxygen supply to these tissues, all these tissues, they can come down with that. Apart from stroke, the eye can be involved. The chest, there's something called acute chest syndrome, which I'm not going to bore us with that, but the chest is another area. There can be painful um, um, presentation of the chest, which comes with pain. Apart from that, the other things like cholelithiasis, that's gallstone, which can be caused by so many things, which maybe our next presentation we can talk about that. But there's one called splenomegaly, increased size of spleen, which usually occurs in children, although as they keep getting older, the spleen starts regressing, and that's why they have that usual
Big stomach.
big swollen tummy, big tummy
Yes.
that's usually known with. There is another common one called chronic leg ulcer, usually at the ankle. Once you see that that mark, like a ring on the ankle. The first thing that comes to your mind is to ask the patient whether he has had chronic leg ulcer. And all these things are due to reduced distribution of oxygen to
Oxygen.
these tissues. So a whole lot of them. Of course,
Wow.
kidney symptoms, when there is a kidney disorder, the kidney can be affected still because of low reduced oxygen to the kidney. And that's why we are still going to talk about the fact that they need a good intake of fluid, liberal intake of fluid, which is usually suggested. We'll still talk about it when we talk about how to manage fluid disease. So that's it.
Okay, so I wanted to ask, are there physical symptoms, like a parent, something that a parent would see and say, okay, probably it's time to go to hospital, or this most likely might be sickle cell. Okay, so what physical symptoms should parents look out for? Because I think most of the things you've talked about are a bit internal, maybe after you run tests and all that. But what physical symptoms apart from the
Okay.
eye? Yeah, doc, go ahead.
Okay,
Chairman.
no, sir. If I could come in,
Yeah.
the things he mentioned already
Yes.
are pointers. They are physical things that
Really?
the parents can. Yes, sir. For instance, when you see, she already mentioned that from 6 months. The thing that happens is, number one, if the parents are aware that they are both AS. You
Yeah.
understand? Or maybe one parent is SS. We'll still talk about that in your next question. Okay. So, but if they are both AS and AS, or SS and AA, so they know that SS and AS. So they know that we have a chance of having a sickle cell child. That is if they are aware. If they are aware, as they give birth, they start looking out for these things already. But assuming they are not even aware, maybe they did a test when they were pre-marriage and something went wrong somehow, they didn't know, which we always see these days. You will see that child with very swollen joints, like she said, swollen hands, swollen feet. These are things that you see. This child is having pains, leg pains that you can't explain. These are pointers for somebody who didn't know that they have the tendency of having a sickle cell child. Seeing these abnormal pains that you cannot explain is already a pointer. For someone who may have had one child that is a sickler, or who already knows that, okay, myself and my husband, we are predisposed to this, so we could have a sickler child. Seeing those pains it comes with very terrible pain, like the child will be crying, or those swollen joints. Of course, those swollen joints, swollen hands, swollen feet also causes pains. You understand? So those ones are the physical signs. Those other ones she was talking about, Dr. Nneka was talking about, the kidney related ones, the spleen, those ones are the higher ones that you even see later. The stroke might not be the first thing that you see. It's in somebody who is not being managed well. So these kind of things can now arise later. But if you listen when she started her symptoms, those first ones, she started with pains everywhere, swellings. These are things that you see, and you just have to run to the hospital. And by the time you do a check, you see that the person is possibly a sickler.
Okay, so
Yes,
quickly, Dr. Chioma,
Yes, sir.
is sickle cell anemia, is it only hereditary, or is it contagious? Is it airborne? How can I just for laymen
Okay,
like
sir.
us,
Okay, sir. So it's not contagious.
Okay.
It's basically hereditary.
Okay.
It's something that a child, an individual, would inherit from both parents. Yes, sir. So, as I just mentioned now, if a man is AS and he marries a woman who is AS, so there is a tendency that the S from the man and the S from the woman would come together to form this SS.
Okay.
If a man that is AS marries a woman, or the other way around, that is the second partner is SS, because sicklers do marry too. But if a sickler marries someone who is SS, there is also that tendency to have an S from the first partner with the S from the second partner, form SS. So it's something that is basically inherited.
Okay.
So it's hereditary. You inherit it from both of your parents, and then so that's it. So the person is now a sickler.
Quite
Yes, sir.
interesting. So let's look at prevention and treatment. I mean, can this be cured? Can it be managed? Can somebody, stop being a sickler? I mean, it's not his fault that his parents, gave birth to him. So how can
It's
this be
not, sir.
handled?
It's actually an unfortunate thing. It's an
Mm,
unfortunate thing that somebody who did not you have no choice about the parents, who your parents will be. It is something that you just come to, assume, and the person is a sickler. So it's not something in medicine. When we say something is managed, it means that it cannot be treated. It means that it cannot be totally cured. So sickle cell anemia is one of those things that are managed in medicine. So you just have to keep managing the person all through the person's lifetime. So when you find out that a child is a sickler, most times, like Dr. Neka pointed out before, that is from 6 months. Somebody could escape, assuming the child did not have the symptoms from that 6 months. It could even be by 1 year that you now found out that's okay. It's like this child, you are seeing symptoms, then you go to the hospital. Of course, the doctor already knows that these are pointers. They ask the parents to go and do a genotype, and on seeing the result is SS. So you know that the person is a sickler. So from the moment you diagnose sickle cell anemia, irrespective of who diagnosed it, whether it was just a random doctor, maybe not a hematologist, because it's a case that a hematologist should manage. So is Dr. Ifunanya their specialty?
okay.
Okay, they are the ones that are supposed to manage. So from the moment a parent find out that his or her child is a sickler, the best thing to do immediately is to go to the specialist. In UNTH, we have the sickle cell clinic. There's a clinic that is just basically for them. You
Okay.
go there, they properly do the investigations they're supposed to do. They review the child appropriately, and they start managing. Managing now is giving medications depending on what it is that the person presents with at that time. When they come with the bone crisis, the bone pain crisis, they give things to alleviate the pain. When they have the swellings, they know what to do at that point in time. They also give them some routine drugs. So it's something that basically the doctor knows, the specialist doctor knows what to do. So the best thing a parent can do for the child, or a child actually, or whether even if the person is already grown, is to take the person to the hospital.
Yeah.
The hospital, they keep giving appointments. If they see that the child is stable, they will tell you when next you should come. It's not something that you should now stay on your own and maybe keep searching the internet or looking for drugs or looking for things. It's something that you should let the doctor manage. In that case, you have the child, because the essence is to have the child as much as possible out of crisis, because those crises are usually terrible. And you heard her when she was talking about the symptoms. They are terrible ones. A child could get stroke. This is because there is low oxygen perfusion, like they don't have enough oxygen because of that sickle shape of their, of the cells. Okay, so it's basically managed. She mentioned hydration before. So the person should be properly hydrated. Hydration simply means water. So they take water liberally. It's not a matter of that I'm thirsty or I'm not thirsty. You just drink water. As a matter of fact, in the hospital, they tell them, finish so and so liters of water every day. These
Wow.
are things that you do, and is helping the blood circulation. You're just trying to get the person out of crisis as much as possible. She talked about leg ulcer. You are trying to prevent it. You don't even want the person to come down, because these leg ulcers are terrible. Most times they don't get to heal. But if the person is coming for regular checkup, so sir, most time it's all just lies on routine check. If the person is coming for routine checkups, most times they are fine. But when they now have this crisis, they should also come and be treated. Most times they also need blood transfusion, because their hemoglobin level, their the HB blood count is usually low. And as such, there is how low. I am Dr. Simnaya will know more than me in this area. I think they thrive at a low level that even ordinary people do not thrive on. But sometimes when it now goes lower than that, I mean their HB level. When it
Yeah.
goes lower than that, yes, they know when they will now have to, transfuse the person. Most times there are some of them I've seen when I was working in a private children hospital. Like we had, there was a particular parent that had like 4 out of the 5 children were sicklers,
Wow.
and every month they are transfusing one person. Like every month, one person will be transfused. It was as if they used to do it turn by turn.
That's terrible.
It's a terrible thing. It's something that
That's
nobody
terrible.
wants to manage. It's a horrible thing to deal with, sir. It's a
Okay,
horrible
so,
thing
so
to deal with.
that brings me to the next question. Dr. Funanya, how can sickle cell anemia, ever be eradicated? Will we ever have a time when we say, maybe get to celebrate that there, in the whole of 1 year or 6 months or something, that there have been no sickle cell. Okay, let's say, yeah, maybe let's say in the next 20 years, because maybe this is a bit generational, we get to
Yes.
say that there is no more sickle cell
So,
anemia anywhere. I mean, is this possible, and what steps do you think can be taken to eradicate this disease?
Okay. While Dr. Choma was talking about prevention,
Yeah.
I there's one major way we can prevent sickle cell, which
Okay.
is what we are already doing, and which is creating awareness.
Okay.
We should do much of it, especially those that, apart from being a doctor, there are so many of us that are laymen that know that, see, an AS should not marry an AS.
yes.
An SS should not marry.
That's a difficult
Yeah.
topic. I mean, when you're dealing with emotions, I mean, imagine you have two people in love, and you are telling them not to marry themselves because of one disease like that.
So that's
You
that's
know,
why the picture should be painted well.
No
That's why,
emotion.
yes, it should be painted well. When you paint the picture well to them, you let them know what they are going to be faced with in life. Surprisingly, or not really surprisingly, but fortunately for some people, they are so lucky that they end up not having any child.
any of them.
Yes,
That
it's
is
possible.
sick. I have a patient. She said she has 5 children, and out of the five, one one was, no, two we are became ones, that's they were twins. And so because that those twins were actually SS. So one died at 1 year, one we are managing one presently in the hospital, and it's
Wow.
not funny. It's not funny, but she was lucky to have others, the AS, while only one, which came out to be two, happened to be SS. So it's something that can be prevented if we take enough awareness. But I know it may not be that easy to eradicate it fully, completely. Although there is research, not really research, something is already on to,
Okay.
although you talk about prevention, to treat those that are down with it fully. But they'll always tell you 50-50. Why? What do I mean by 50-50? That bone marrow transplant, because
Okay.
may not survive it. Really, it's an intense and invasive procedure that the patient may not survive the outcome, the result, the complications that come out of it. So it can be treated, but you can, I don't know. As I said, it's 50-50. Person may not survive it. I'm yet to get a rundown or the number of people that have done it and that survived. So that's a treatment which many people would not want to do.
So
So
true.
for prevention, one thing I also want to talk about is the fact that some people actually don't get to know about their genotype, simply because they don't um, come down with any of
Details.
these symptoms. They don't come down with any of these symptoms until maybe they're ready to get married, and they now want to do a marriage
Yes.
test. They now
Yeah.
ended up, they now finally do the test, and then now becomes the point that they are actually SS all this and they haven't been down with these symptoms. And okay, I know of one case, one story like that, that the man already in his 40s, he got to know that he's a sickler because his child presented some of these symptoms.
Wow.
It's really
Wow.
funny.
Can you
And
imagine?
and that was how he himself, and I heard his own in the medical line, and that
Wow.
was how he got to know about it. They now said running test him and his spouse,
Right.
and they found out that he has a wife, and they found out that they actually the man is actually SS, while
Oh,
the woman
How is that possible? I mean, you mean he grew that far, he grew that old,
without,
and no
yes,
that's rare.
symptoms?
It's
yes.
possible.
This is
Alright.
it's
Wow.
possible depending on some some more technical genes or more technical mutants. Let me not
Okay.
use the technical word here, but there are some
Gene.
genes that can be lenient to the patient.
Yes.
There are some of them that can be lenient to the patient. Let me
Quick
say
one,
it like that.
Dr. Neka, let me ask you,
Yeah.
does diet have any way, does it play any role in, the management of sickle cell anemia, the kind of things people eat?
That's why we talked about liberal fluid intake.
Okay.
Yes, taking enough fluid, and of course, when you take food that have more of these vitamins, especially vitamin B and C, which is also a part of their routine medication, it will also help them stay away from all these infections, and of course it will help them boost up their immune system and help them fight these infections. Of which one of the infections, which I didn't talk about earlier, was urinary tract infection that they usually come down with.
Okay, quite interesting.
Okay. So I wanted to
Please,
lend my
Doctor.
voice on,
Yes.
yes, I wanted to just lend my voice still on what she already said on prevention.
Hmm.
Okay. So just basically the knowing your genotype, when we're talking about emotions,
Yes.
is a terrible thing.
Hmm.
Sometimes it's good to have seen this picture. If you have seen the picture, and the trauma is not just for the child alone. For the child is terrible, but even you, a parent, seeing
Yes.
your child in constant pain,
Pain.
seeing your child go in and out of hospital all the time, seeing your child being transfused, at some point you will be donating. Sometimes you just have to go and buy the blood. Like
Yes,
these things, I wish it's possible for one to see it even before getting married. If you see that, if you see how terrible it can be, it will help you to make sure that emotions don't even drag you into this thing, unless you don't want to have children. Yes.
Emotions are strong.
No matter how far you have gone, no matter how far you have gone, once this thing is discovered, the only people I usually pardon are maybe people that said, hey, we didn't know. I didn't know my genotype. I only checked because we were getting married and I went to this lab. These days, they even tell you check in up to 3 laboratories
Yeah, to
just so
confirm.
that you're sure. Yes, just so that you're sure. And if both of you are ASAS, just stay clear of each other. It means that one is not your missing rib. Go and find another missing rib and let the man go and find another one.
Yeah.
Okay, so that's just basically it. So the main form of preventing it, just like you said, that in years to come we'll not have it, is about people not marrying, someone not marrying another person that is AS. Okay, so then there was something else I wanted to point out.
Okay.
There are some investigations that can now be done to help people that the emotions eventually dragged into getting married. Okay, they couldn't separate. They felt that they just have to get married. So if that be the chance, the case of a certain couple, then they should better be rich, because these investigations are expensive. Yes. So there's something called amniocentesis.
Okay.
Amniocentesis, yes. So it's a test that a woman who both the woman and the man are ASAS, so have chances of having a sickler or maybe SSAS. Okay, It's a test that the woman can do. I think it's about 15 to 20 weeks of pregnancy. Okay, that's in her second trimester. She can do that test, and they will find out in that test if the fetus is likely to be. It's not even likely. If the fetus is a sickler, they can do that test. And if the person is a sickler, I actually know someone who has done it. Okay, and if the fetus, that child they were going to born was going to be a sickler, they will abort from that moment.
Wow.
And then they go, yes, and then they go to try again.
Wow.
These tests are very, very expensive. Yes. There's even another one, chorionic villus sampling. So these are expensive things that you don't just see any random person doing. Maybe now in Nigeria, there might just be one or two centers. It's something that you might have to travel abroad. So that's what I meant when I said they should better be rich. Number one, they should be aware, and then they should be rich. Yes. Okay. And then they should not plan to have many children. Because if you plan to have 5 children, does it mean that at every time, what if you do, and then it's supposed to be a sickler you abort, you go again, you abort, maybe it's the 5th chance. So let it just be a couple that intend to have 1 or 2 kids. They feel that the love, they cannot separate. So this is also a possibility for them. But I mean, the best thing is just to stay clear. There are many men and there are many women. Don't find yourself another person to marry.
It's easy to say when
I know it's not easy. When the chips are down, I know it's not easy, sir. But I repeat that if you see, when I was a house officer, there was a child then in chair, Dr. Ifunanya, in children emergency. It was terrible. This child was already, I think she should be about 10 to 12 years of age. This child can cry for 5 hours non-stop.
Oh my God.
Like, the thing was heartbreaking. Even her mom will be crying. When you see such horrible sights or experiences, you don't want to have that kind of child. And that thing happened in April. There's no guarantee that it will not happen after 2 weeks. There's no guarantee that they will not come to hospital the next month. I know that some people are lucky and they won't be having constant visits, but some other people are not lucky. Like, they come to the hospital as often as. So after seeing some of these things, you want peace in your marriage. You don't want you and your husband to be frequenting hospital.
The hospital, the stress involved.
Yes.
Yes.
So that's just it.
Yes, I understand recently, some days ago, Dr. Nneka, you said something?
So I said, creating awareness is really the way forward.
Very important, yes.
Yes. Yes. So talking about awareness, I understand some days ago the world celebrated the World Sickle Cell Anemia Day, right?
Yes, sir.
Yes. So
yesterday.
Oh, that was yesterday. So talk to us about what's this day about, Dr. Nneka?
Okay, it's about the day was just separated just to let people know about sickle cell anemia, sickle cell disease, and just still, as I talked about, to create awareness about sickle cell anemia and the fact that it can be reduced, if possible, eradicated.
Yes.
So it's just all about creating awareness. That's why the day was brought out, and that's why we're marking it. Yeah.
Yes. Dr. Chioma, do you think the government is doing enough to create this awareness?
Well, just like Dr. Nneka said, I think most times it's WHO that does that. That's the World Health Organization. Okay, so they try to bring out some days to mark certain disease or ailment. Okay, like a certain day that will be set out for people to make noise, for people to talk about, not good noise actually. Yeah, to talk about like how yesterday was just World Sickle Cell Anemia Day. The theme was shine the light on sickle cell.
Okay.
Which is what we are doing. We are shining light. We are shedding light on it. We are trying to tell people this is because a lot of people, you'll be surprised that a lot of people still don't know what this is all about. Yes, some know and they are just stubborn. They don't. Yes, but a whole lot others don't even know what this is all about. So WHO from time to time try to come up with these certain days mapped out. There are so many other things that you have: World Environmental Day, World Malaria Day, World, Breast Cancer Awareness, and all that. Yes. So that's why sickle cell anemia is that important. That's why they also set June 19th apart as a day to talk about it. So basically, government now joins them. It's all about knowing that, okay, this day has been set apart for it. Even beyond what we are doing here now is a private thing. Most times you see radios, radio, television programs, people talking about it, yes, hospitals and all that. So that's just basically what it's all about, creating that awareness. Most times this particular awareness is not something that you do in the hospital. It's something, because of what is involved, it's something that you should tell, you should talk to people about. Most times is counseling of young people, because you're no longer talking about the old couple who have already gotten married and they're already having children that they can't go back anymore. You are talking to people who haven't gone into marriage. You are talking to people who want to get into marriage, when they go for the premarital classes that different churches do. Yes, you are there, you are trying to talk to them. You are doing this radio program. Perhaps somebody who wants to get married is hearing it, and he or she knows that what I should do now, the first thing I should do, even before going deeper into that relationship, is to find out what the person's genotype is, so that I would know whether we are compatible, whether we should go ahead or not. Yes, so it's just all about, this particular one is all about awareness, which is what this sickle cell day helps to do. And then even beyond that, we are no longer doing it on World Sickle Cell Day, but it's all part of it. As you broadcast this, as people hear it, they get to know that these are the things that this can, lead to, and they get separated on time. So thank you,
sir. So one final question, and I will let you busy women go. Do you think it's important to bring this awareness down to the much more younger ones, let's say down to secondary school level? Because, it seems as if we've been discussing about those in the who are about to get married, who have, to get into a relationship. But, nowadays, you have the teenagers in the secondary schools. So do you think this awareness needs to come down to that level? Dr. Neka, what do you think?
Yeah, I think so. It's necessary, because so many people engage in sexual activities, not even before marriage. So it's to let them know about it, so that the product of the sexual activity doesn't give birth to a sickler, which is another issue. So it's necessary letting them know about it. Even those that are already done with it, they should also know how to take care of themselves too. So creating awareness as going as low as secondary school level is something important for us to do. Yeah.
Okay, I thank you so much.
Yes, if I also add to what she said, even beyond them, engaging in the sexual activities, the truth is, the more one gets to hear something, like it begins to stick. Even in that teenager, even in that 15-year-old boy, 16-year-old girl, they start hearing about this thing on time.
Really,
One thing it even does is that they try to check themselves. She's not ready for marriage. She's not thinking about marriage yet. She has not even gone into secondary school. Her father has told her that you must finish university. She has not entered into university. Her father has told her that you must finish university before you get married. But she starts on time. The chance, if that's, that genotype, most times when somebody wants to enter into school, even primary now, they ask us to do it. But if it's possible that they did it and in the lab it was wrongly, the result was wrongly given. Being aware makes that girl or boy to go ahead and say, please, let me do this test again. Let me do it in another lab. Let me check. Before you know it, she already knows, she's sure what her genotype is. She has been hearing what this is all about. She's aware. So before she now enters into her 20s, or he enters into his 20s, it's already at the back of his mind, yes. So I agree with you, sir, that it should go down. We should actually start.
It looks like we've lost.
The more difficult, yes, to ignore it, unlike, those ones that have come of age. So thank you very much.
Thank you, Dr. Neka. Thank you, Dr. Chioma, for taking our time to be on Ask a Doctor today. We appreciate your time, and For those who are watching, please follow us on our different social media channels. If you have a question for the doctors, I'm sure they would, in their spare time, they would answer your question. So please, wherever you're seeing this video, leave your comment and we will do well to let the doctors know. So probably in the next session, they could take some of these questions. Okay, so thank you very much. Please do well to follow us on YuSocial.com. Sign up and create your account. If you're on YouTube, please join us there, like our page, our channel, and do well to share this video too. Thank you once more, Dr. Nneka and Dr. Chioma, and we hope you would oblige us to be at the next session.
Thank you.
Okay, thank you very much. So,